G'day YouTube, Warbles on a lot here. Unless you've been living under a rock, you're going to be aware that there's a dispute, a heated debate currently ongoing between Beijing and Washington as to the origin of COVID-19. The considered opinion of the world's most learned virologists and epidemiologists is that a virus that used to live exclusively in small numbers in healthy bats has bred up in the bat population when the bats became stressed, probably by being captured and taken to market. The stressed bats with a high viral load were somewhere where, in some way, they could infect some other species. My personal theory, personal hypothesis, not a theory because you can't test it, is that somebody was cleaning and gutting a consignment of bats. You know, customer come and wanted to buy a couple of dozen bats. The bat guts were fed to the pangolins because they're forest floor anteater scavenger types. Then the pangolins were butchered and people breathed micro droplets of pangolin blood with virus in it in the air and therefore got the bat pangolin cross virus because there are some mutations that are not bat, but they are pangolin. And that's how it got into the human population. Now, whether that happened actually in the Wuhan wet market or whether that happened in the farm that supplies the wet market, I don't know. Because like there are 400 of those wet markets in the one city, and it's all this has apparently only come out of the one. But there's one of two different accounts which state that the very first patient hospitalised with pneumonia had no contact, had not personally been to the wet market. So they may have encountered the virus somewhere else, or they may have encountered it from somebody who did go to the wet market. But that all happened back in November, December. For about a month and a half, various levels and layers of Chinese middle management bureaucrats, all members of the Communist Party, it's true, but not decision makers. They were decision implementers. They all tried to hush it up, cover it up, minimise it, say that nothing was happening. That's kind of normal. And it's not normal only in communist dictatorships, fascist dictatorships. Here in Australia, in New South Wales, the New South Wales Department of Health decided that because the percentage of patients with a respiratory illness was less than 0.1%, maybe it was less than 1%, less than 1% of the passengers on the Ruby Princess had a respiratory illness. Therefore, it was okay to let them all go, even though 150 were sick with respiratory symptoms. 9 had been tested, almost 15 had been tested, 9 were in hospital and 1 was already dead. But because the number worked out to 0.94%, not 1%, therefore it was okay to let them go. And the fact that the Department of Agriculture had sort of jiggled the elbow of the Health Department, Federal Department of Agriculture, State Department of Health, and said, hey, hang on, are you sure about this? Oh, yes, we're sure about this. Yes, it's not a risk. It's not a risk. But the figures they were saying it's not a risk, those figures were 2 or 3 days old. It's entirely possible for well-meaning, well-intentioned, allegedly well-trained, diligent bureaucrats fighting little turf wars. I mean, the epidemiologists from the New South Wales Department of Health giving evidence at the Royal Commission into how come they let all these COVID-19 incubators go into Australia's broader population. burst into tears and said, we all worked very hard. We did the best we could. We'd do it differently if we were doing it again today. But, we all meant very well. We didn't mean to do that. Now, that happened in Australia. And in Australia, the effect of that happening was to frighten the shit out of everybody who'd ever attended any medical lecture above the level of student nurse's aide. The idea that they let 2,700 people off a boat where 150 people were already sick, 15 had been tested, 9 were in hospital, and they've just let them go on buses and trains and planes and cars and taxis all over the bloody country. Yep, that's what frightened Australia into taking actual lockdowns, like third week of February kind of thing. Australia had already taken shit seriously because when China started trying to lock down that one little province, that's when Australia said, okay, you can't come from China to Australia unless you spend 2 weeks in quarantine in some other country somewhere, like Thailand or Singapore or Taiwan. You go somewhere else and you lock yourself in a motel for a fortnight, and if you're still healthy at the end of the fortnight, then we'll let you come to Australia, and then we're going to put you in another motel. So that really cut down the number of people coming to Australia from China. But rather than try and rely on my recollection of what happened, first let me state that the US response was no faster than China's response. And the difference is that when China's top level of government realised that they had an actual serious problem, they started welding people's doors shut to keep them in the apartment to stop them from going out onto the streets. They built a pair of 1,000-bed hospitals in like 10 days flat. If one level of Chinese bureaucracy got the message that, bang, we need masks and stuff, we've got to stop exporting them, and other bunches of the Chinese bureaucracy hadn't got the message because, from memory, first the Chinese municipal government got somebody replacing them. Then the province, which is the kind of the Chinese equivalent of a state, I guess. Then the state government, they got replaced. And then finally it all got bucked back to Peking. And when Beijing got involved, that's when Wuhan really started to move. Until then, everybody was trying to keep Beijing of the opinion that there was nothing wrong. And the tourist and travel industry wanted everybody to be able to go home for Christmas and for the Chinese New Year. Well, I can recall Trumpy wanting to reopen for Easter. So, yeah, China got on top of it. Australia got on top of it. New Zealand's got on top of it. America has not got on top of it. They've had a couple of weeks of lockdown. The people who've got problems with their businesses are complaining and screaming. Trumpy has encouraged Second Amendment rights activists to go out there and form protest mobs in the streets. So it looks like America's going to reopen for business, despite the fact that they've still got between 2,000 and 3,000 new cases a day. If COVID or coronavirus 2, SARS new corona, if it goes back to its wild spread rate of 1.3, you can pretty much expect that at the end of a month, 80 to 90% of Americans will have it, and at the end of 2 months, 7% of their population will be dead. So yeah, they might be looking at 2 or 3 million dead. Because freedom? My understanding is that if you've got old people who are unwell, and a big part of the American population is old people whose lives have been extended by modern medicine, so therefore they're living with several geriatric maladies. Once upon a time, the first geriatric illness you got was your last one because you didn't recover from that. Now people do, live well on into their 80s. Not begrudging them that, but it means that they're pretty easy meat for a pandemic respiratory virus. Also, people who are stressed, people who are poorly fed, people who are overcrowded, people who don't have good plumbing and sewage, people who don't have the resources to be able to lock down and stay away from other people who might be sick, people who don't have universal health care. These are places in which the virus is going to go pretty close to at least achieving its natural kill rate, which is about 7.5%. Certain parts of Italy there for a while, it looked like 30% was the kill rate among the diagnosed cases. And sure, there are lots of people who don't feel ill, so they don't get diagnosed, so they don't show in the figures. And that might mean that the actuarial death rate is only half of your 7.5%. But in terms of the number of people who know that they're sick enough to go to the doctor and say, sniff, sniff, have I got COVID-19? Yes, you have. Well, if the doctor says, yes, you are diagnosed with COVID-19, on a broad whole of population basis, you've now got 7.5% chance of being dead in the end of the month. If you're over 50, your chances of being dead are better than that. If you're a man, your chances are better than that. 90% of the people who are dead are over 60. Doesn't mean that 20-year-olds don't die. But this virus is kind of fine-tuned to hit the old people. And I can't take my mind away from the thought that if you're going to thin out the people who voted for global warming, people who voted for deforestation, the people who voted for over-harvesting, overfishing, pollution, then you got to hit the old, because the young people, they didn't vote for it. They were born into it. Somebody my age, I'm 59, I've been voting for 40 years. You want to get the people who put the world in the position that it's in. Yeah, my age cohort, we're the ones who need to be thinned out so that Greta Thunberg's generation can have a larger proportional voice in whoever's left afterwards. As a 59-year-old man, it means by shotgun principle, yeah, I got a bit of a target on the back of my head. Fair's fair. I wasn't loud enough, obviously. I didn't convince enough of my peers to vote green. If everybody on the planet had voted green for the last 40 years so that we had constrained industry, so we had stopped clear felling, if we hadn't put the pressure on the forests, then we wouldn't be stressing out the bats wouldn't be breeding up the virus, and we wouldn't be getting zoonotic diseases. Funny that, isn't it? But anyway, because I'm largely informed by ABC Radio FM National Network, which is like the intelligentsia end of the Australian Broadcasting Corporation, and by New Scientist magazine, it means that I've heard a lot of things and I can process them, but I can't often give decent references. But I've also read a lot of things, and I keep the magazines. So I thought it might be interesting to go back to December and have a quick scan through New Scientist and see what we knew and when we knew it. Because in the excited states, they're making, well, the government's making a big thing of the theory that it's possible the virus originated in a Wuhan germ warfare lab. Therefore, because the virus has caused pandemonium in the United States, it must have come from a germ warfare lab. Pompeo's claiming that China has a history of substandard laboratories and of releasing or losing control of viruses onto the world. No. MERS was Middle Eastern Respiratory Syndrome, and you got that from kissing camels. Hendra virus is horse kisses virus, and you get that from keeping your horse underneath a tree where distressed bats are shitting in your horse feed and then kissing the sick horse. Ebola is bat eaters virus from Congo. Marburg was another bat eaters virus. SARS, that I think that did come out of bats, and people blamed the pangolins. And it wasn't as contagious. It was more deadly, but it was less contagious. It frightened shit out of a lot of Asian countries, and therefore a lot of Asian countries, when this novel SARS-CoV-2 came out, they reacted very, very swiftly because they knew how hard it is to control if you let the daily new caseload climb above 500. Here in Australia, our daily caseload got a bit above 400, and we went Burko and locked ourselves down, and it's now down to less than 10 a week. No, sorry, less than 10 a day. A couple of days we've only had one or two. New Zealand's now down to none. But anyway, let's have a bit of a look at the New Scientist magazines and see what they got to say about coronavirus. We have two piles. Those are the unread. I'm 40 pages into the 4th of April, so I'm a month behind. Those are the reds. Turn that upside down. Damn, I nearly missed one. New Scientist, Christmas, New Year. Greta Thunberg was the big news. And the only mystery illness was reported as having a genetic cause, 7 people with a mysterious disorder. So the end of December, there was nothing in New Scientist. 4th of January, where the editorials on a self-experiment into veganism. And the health news concerns nerves at risk from genital surgery. 11th of January, Australia's fires make the editorial. And in the news, 11 January, unknown illness hits China. At least 59 people in China have become ill with a mysterious pneumonia, 7 of whom are in a serious condition. Chinese authorities still don't know what has caused the disease outbreak, but have ruled out SARS, MERS and bird flu. It seems that a new virus or bacteria might be the cause of the disease, says Shenglin Tang at Duke University in Durham, North Carolina. The cases reported to have occurred in Wuhan City, Hubei province are being investigated by Chinese health authorities. They say there is no evidence the infection can be passed between people, but it is too soon to definitively say that it won't spread this way. Okay, so at that point, the Chamber of Commerce doesn't want to admit what's going on. No deaths have been recorded, but that doesn't mean the infection isn't dangerous. It's hard to know how severe a disease is, especially a new infection, because you only see the cases that are severe enough to be detected. Several of those affected worked in a local market known for seafood. The market was closed on 1 January, according to a report in the Wuhan Evening News. All the affected individuals became ill between the 12th and the 29th of December. The symptoms include fever, and some people have had difficulty breathing. All are receiving medical treatment in isolation, and the people they have had contact with are being evaluated. As of 5 January, the Wuhan Municipal Health Committee had ruled out influenza and adenovirus, which can cause colds, pneumonia and conjunctivitis, in addition to bird flu, MERS and SARS, which was responsible for 774 deaths in 2003. The World Health Organization is closely monitoring the event, says spokesman Fadila Kahib. All right. I think I'd heard about it perhaps 3 or 4 days before I got my copy of the magazine on the radio. 12th of December, they're claiming as the first case, and at this point, nobody had died. And yet, the news had made it out to the Western press. I don't see how any rational person can seriously expect China's bureaucracy, I mean, there's 1.5 billion of them, to have done any better at detecting a novel viral pneumonia. I mean, you know, you're going to have to wait until you've got 50 or 100 people infected before you're going to notice that you've got a cluster of people turning up sick enough to need hospital treatment. And then you've got to watch them for weeks more before you notice that some of them are not recovering. And during that time, it's spreading. Anyway, 18 January, editorials on fire and ice. News on China is smaller, but it's still there. Cause of a mysterious pneumonia in China has been identified as a virus by local authorities, according to a statement by the World Health Organization. Tests run on 15 people who are unwell suggest that they are all infected with a new coronavirus in the same family as SARS and MERS. The genetic sequence of the virus was shared with the international health organisations on 12 January, which should make it easier to diagnose infections. As of 13 January, 41 cases had been linked to the new virus in Wuhan City, Hubei province, according to a local health committee. So you're still listening to the Wuhan Municipal Health Committee. Symptoms range from fever to difficulty breathing. 6 people remain severely ill. 1 had died. All received medical treatment in isolation, said Chinese authorities. Some had since been discharged. Outside China, a woman in South Korea and another person in Thailand, both of whom travelled from Wuhan, appear to have the virus. In Hong Kong, 67 people have been admitted to hospitals with similar symptoms, although 51 of them have since been discharged, and none have been definitively linked to the new virus, according to media reports. And the health section of 18 January's paper is talking about Alzheimer's. 25 January, tutorials on genetic analyses of common causes in mental health. News page, Wuhan virus spreads. We now know the virus responsible for deaths and infections in China can pass between people. 25th of January. At least 6 people are reported to have died after being infected with a new virus spreading in China. The coronavirus can spread person to person, the country's health ministry has confirmed. Okay, so that's 5 weeks since the first case on the 12th of December. 5 weeks? And already the health minister of China has swept all of these bullshitting bureaucrats aside, and he's admitting worldwide, yes, it can transfer from person to person. You know, like, we're going to go flat out and do something about this. I don't see why America or anybody is complaining that China was slack. China told everybody what they knew when they knew it, but the people at the grassroots, as they like to say, were doing their best to minimise the scale of their problem as far as what they were reporting up the chain of command, because in a totalitarian system, nobody wants to be the one who tells the boss that the shit's hitting the fan. It's just a human nature thing. It's a bit like the number of career bureaucrats and public servants who've been fired in the Trump administration for telling Trumpy the truth. So now he's surrounded by sycophants and toadies who just want to say, sir, yes, sir. And yeah, maybe 7% of America are going to die in the next month. Ipso facto per se, because of that. They've chosen to do it to themselves. Returning to the 25th of January. The 2 latest reported deaths in China were that of a 66-year-old man and a 48-year-old woman in Wuhan, according to the Wuhan Municipal Health Commission. 60 new cases were reported in the region on 20 January. Among them are 15 healthcare workers. According to the news site China Daily, Zhongnan Shan, head of the Chinese National Health Commission team that is investigating the outbreak, has now confirmed that 2 cases of infection had been caused by human-to-human transmission. Quote, it is now clear there is person-to-person transmission, which is a worrying development, says Rosalind Ego at the London School of Hygiene and Tropical Medicine. Quote, we've got to wait and see how sustained that transmission is. The Wuhan Municipal Health Commission said that 258 people have been infected in that part of China. At the time, 227 of them were still being treated in the hospital. Cases have been confirmed elsewhere in China, in Guangdong province, Beijing and Shanghai. Beyond China, a handful of cases have been confirmed in Japan, Thailand, South Korea, Taiwan. All people, either people from Wuhan or those who had visited the city. When New Scientist went to press, the Director General of the World Health Organization was due to hold an emergency meeting on Wednesday to decide whether the outbreak constitutes a public health emergency of international concern and to issue recommendations on how to manage it. Quote, "This is a critical point in the outbreak," says Ego. "Although there are more signs that this outbreak is serious, we still don't know exactly what's going on. Over the next week or so, we'll find out how easily the virus can be passed from one person to another and whether the infection is spreading in countries outside China. In total, nearly 300 cases of infection with the virus have been confirmed, but a report released on January 17, based on infectious disease modelling, suggests there may be hundreds more cases in the city of Wuhan that haven't been diagnosed. Given the number of cases reported outside China, it's possible that more than 1,700 people have been infected in the city, suggests Natsuki Imai and her colleagues at the Imperial College London. The team reached that estimate based on the number of international travellers flying out of Wuhan, the population of Wuhan International Airport's catchment area, and the fact that, on average, it appears to take around 10 days for an infected person to start showing symptoms. In Australia and several countries in Asia, air passengers arriving from China will be screened on arrival to see if they have a raised body temperature or other symptoms. The US Centers for Disease Control announced last week that it will begin screening travellers from Wuhan at airports in San Francisco, New York, and Los Angeles. We know the pathogen that is spreading in China is from the same family as the SARS and MERS viruses, which can also cause acute respiratory illness and which led to fears that they could become global threats. Third time lucky, eh? And in that same issue, mental health talks about pregnancy and PTSD, immunology, with a feature on food allergies. Going forward another week, 29th of February, coronavirus has made the front cover. Whoops, damn, I got those out of sequence. We shall try again, moving from 25 of January to 1 of February. As I thought, coronavirus got to the front cover. And here we see the Chinese furiously building a hospital in 10 days flat. 1 February, best we be prepared. A deadly new virus is spreading rapidly around the world. In a matter of weeks, we've seen almost 3,000 people infected across at least 12 countries and more than 80 deaths. But epidemiologists are warning it has the potential to spread further and claim more lives. We know the airborne virus can spread between people, and Chinese researchers studying it have warned that it seems to be able to spread before symptoms show. That might explain why it's spreading so much faster than SARS did back in 2003. As New Scientist went to press, reports of the first possible cases of person-to-person transmission outside China were beginning to emerge. If SARS, MERS, Ebola or swine flu have taught us anything, it is that we need to be prepared. The reaction of national and international health agencies is key. The controversial decision by the World Health Organization to hold off on declaring a public health emergency of international concern is one it may come to regret. The agency is still facing criticism for its delayed response to the Ebola outbreak in West Africa. In the meantime, China is due some credit. The country has swiftly responded to the outbreak. Local health agencies reported the first suspicious cases back when there were only a handful of them, and the world has been updated on a daily basis since. The food market at the centre of the outbreak was shut and disinfected as soon as it was identified as a possible source. Chinese researchers not only sequenced the genome of the new virus in a matter of days, they also immediately shared their results with the international community. As a result, diagnostic kits exist in multiple countries. China's lockdown of several cities is unprecedented and certainly isn't foolproof. It is impossible to fully stop the movement of people, but it is a big step in stemming the virus's spread. Other countries, including the UK, have insisted they are prepared to deal with any outbreak. Let's hope we won't find out if that is true. 1 February. On page 8, there's a full page in the news on Wuhan virus. Unless you've been living on a rock, under a rock, you will recall this sequence of events. I propose to more or less only read the editorials while scanning to see how many mentions there are in New Scientist magazine as time moves on. There you go. 1st of February, and the health update is on pregnancy and menopause, paleontology, ancient mummy, microbiology, optimum cup of coffee, space. Forget medicine on snake venom. Okay, 8th of February. Good, we're back in sequence. Coronavirus, front cover. Big news. Top of the table of contents. Editorial, deadly unknowns. We are still scrambling to understand how dangerous the Wuhan coronavirus is. For those of us who turn to science for answers, the Wuhan coronavirus outbreak is unsettling. We don't know what proportion of infected people are likely to die. Our figures for how many other people on average each carrier infects are only estimates, and the total number of cases is likely to be far higher than those confirmed so far. These three parameters are crucial for epidemiologists who use models to calculate how bad an outbreak will get, but we don't yet know what values to punch into the models. As cases in China soar, the list of unknowns gets even longer. It remains unclear whether the virus can spread before symptoms show. We don't yet know how or when the virus is likely to have crossed over from bats, see page 10, or why the first known human case of the virus seems to have no connection to the Wuhan food market where the outbreak appears to have begun. Is every case equally infectious, or are some people unlikely to pass it on while others act as super spreaders? And is the virus only deadly for those who are older or who already have chronic conditions? What we do know is that the outbreak is likely to go one of three ways, see page 8. As this magazine went to press, the outbreak seemed on the verge of becoming a pandemic in which multiple epidemics of an infection take place across the world. From here, the virus may either peter out or go truly global. We can't know yet how many lives this would claim. If it goes global, it could one day resemble flu, in which every year causes an estimated 3 to 5 million cases of severe illness and about 290,000 to 650,000 deaths. Flu can cause mild symptoms in some people and much worse ones in others, and most deaths occur in people over the age of 65, all of which may be true for the new coronavirus. There is another option. The race is on now to find drugs and vaccines that could help bring the virus under control and prevent global exposure. While drug development will take time, trials of existing drugs are already underway in China, see page 11. If successful, we may be able to save many lives, although we can't calculate the number yet. Special report on coronavirus inside Wuhan's lockdown. What happens next? With some vintage numbers when there are only 17,000 confirmed cases and 1 death outside of China. Coronavirus has spread. 2,000-bed mobile hospital, understanding the Wuhan virus. Viruses from animals. Other infections that have jumped. The race for treatments. And then you get back to the rest of the news. The health feature on a tablet that could replace injections. Moving on. 15 February. Coronavirus still on the front page, still on the top of the table of contents. No longer the editorial. However, it leads the news. How bad will it get? The World Health Organization has now named the new coronavirus COVID-19. If the virus isn't halted, it could infect 60% of the world's population and kill 1 in 100 of those infected, around 50 million people. Gabriel Leung at the University of Hong Kong told The Guardian on 11 February, but nobody knows if it really will, because we don't know whether the virus can be contained, how deadly it is, and how many people have it. The number of confirmed cases globally reached 42,000 on Tuesday, but the rise in cases has been slowing since 6 February. This suggests China's decision to limit people's movements in the most affected province, Hubei, is working and that the containment may be effective. That isn't certain, however. The decline may also reflect overwhelmed hospitals or testing labs. Such studies continue to estimate that there are far more cases in China than those reported. What's more, tests of people repatriated from China hint there are many mild and asymptomatic cases who may be able to spread the virus but aren't necessarily being tested or quarantined. Even if mild cases are being tested, they may not be making it into official figures. Diagnostic guidelines issued last week in China say people without symptoms who test positive for the virus as part of efforts to trace contacts of known cases should only be counted as confirmed cases if they start showing symptoms. Yeah, well, that's a bit of a mistake because they're going to be running around spreading the virus, aren't they? As for death rates, these are hard to calculate early in an epidemic. And then they go on for half a page talking about how they don't really yet know how to count the deaths. Whereas I say you take the total number of deaths as at today and divide those into the total number of cases diagnosed as at 18 days ago, because it takes you 2.5 weeks to die or recover after you are diagnosed. But you know, I haven't sat a virology or epidemiology lecture or exam since 1983, 1983. And back then they told us what we had to worry about was a zoonotic viral pneumonia which would spread into a pandemic because it was droplet contagious. So, how much testing are they doing in Africa? It's kind of interesting. The COVID-19's coronavirus is similar to one detected in bats in 2013, but a failure to act on the warnings of those who studied it means we missed an opportunity to protect human health. While some are now saying the COVID-19 virus passed to humans from pangolins, it's likely the pangolins are merely victims of the infection like us. From the virology evidence available to date, the virus is almost certainly from a species of bat, says Andrew Cunningham at the Zoological Society of London. For years, Zhengli Shi and her colleagues at the Wuhan Institute of Virology have been isolating coronaviruses from horseshoe bats in caves in China's Yunnan province. In 2013, they found a coronavirus that could infect human cells in the lab. Last week, Shi reported that this virus is 96% identical to the COVID-19 virus now spreading in people. In 2016, Wayne Marasco at Harvard Medical School and his colleagues found that the virus discovered by Shi's team could replicate in human airway cells. They described it as being, quote, poised for human emergence. However, they say further research on this virus was hampered by the US government's ban on work that alters viruses in ways that might make them more dangerous. Shi's work has also revealed that viruses can pass directly from bats to people living near their caves. The similarity between COVID-19 virus and a virus found in 2013, her findings suggest we didn't need pangolins to catch the COVID-19 virus, just as she previously revealed that SARS can come directly from bats without first infecting civets. Last year, she warned that it was highly likely that coronavirus outbreaks would originate in bats in China. Quote, the investigation of bat coronaviruses becomes an urgent issue for the detection of early warning signs, unquote, she wrote. Now this opportunity has been missed. She made a plea for increased efforts to develop drugs and vaccines, written by Deborah Mackenzie in the virology coverage on the 15th of February. My understanding is that the other 4% of this virus is pangolin. It's similar to a virus that lives in a pangolin. You've got 96% of a bat virus mixed up with 4% of a pangolin virus. That gives you the novel coronavirus, which infects people. All you had to do was stress out the bats and then rub them up close to people. And that's what apparently happened. Just that one little report there kind of makes mincemeat of everything that Trumpy and Pompeo have been saying about China having a history of covering this shit up. They've been talking about it for 7 years. This week's Health talks about ultraviolet sensitive lenses and the dermatology of Botox. 22nd of February, coronavirus on the top of the front page. Cultured meat makes the editorial. News leads off with, is it super spreading? If the COVID-19 virus is transmitted largely by super spreaders, it might not go pandemic. For yet another week, COVID-19, the disease caused by the new coronavirus, has remained poised just short of becoming a pandemic. As the case counts stabilise in China and don't take off elsewhere, the big question is, will it happen? Every scenario is still on the table, said Tedros Ghebreyesus, head of the World Health Organization in Geneva, Switzerland this week. To be pandemic, COVID-19 has to spread generally in a population outside China, not just in limited clusters triggered by a known case, as has happened so far. We are not seeing that. Mike Ryan, head of the World Health Organization's Emergencies Program, said on Monday. In China, cases outside Hubei province, whose capital Wuhan is the epidemic centre, have stopped rising. Apart from a jump last week as China redefined some 15,000 unconfirmed cases as COVID-19, the number of new cases reported daily seems to be falling. Hubei peaked around 6 February and daily case numbers are dropping, said David Fisman at the University of Toronto, Canada. He says this is unlikely to be due to cases not being reported and that the fall was predictable based on trends seen in January. On 15 February, France confirmed Europe's first COVID-19 death, an 80-year-old Chinese tourist hospitalised in Paris a month ago. See, it takes a month between getting sick and getting dead. But cases outside China are infecting fewer people than expected, given the rate of spread in China. Using epidemic models, Justin Lesler at Johns Hopkins University in Maryland says this fits a situation in which only 10% of cases are responsible for 80% of transmission. In other words, most cases are caused by super spreaders. Well, yep, it went on for another half a page, but that turned out to be wishful thinking. And yeah, 22nd of February was when various drug treatments came out. Will heat kill coronavirus at the changing of the seasons? Messages scrawled in the snow in China. Drones carrying anti-corona messages. The health entries on neuroscience, 8 brains are more like ours, and medical ethics of what it means to be human. Coronavirus has moved to the views column. So we move on. Now we get to 29 February. Beyond containment. Coronavirus cannot be stopped, but it can be slowed. Pandemic in all but name. Will the corona outbreak become a pandemic? It's increasingly looking like it won't, but only in name. At a press briefing on 25 February, the head of the World Health Organization, Tedros Ghebreyesus. That's his name, Ghebreyesus. He was apparently promoted to the head of the World Health Organization on Chinese lobbying. A yes man, Ghebreyesus. Not Ghebreyesus, Ghebreyesus. And he was promoted to the head of the World Health Organization, more or less specifically so that he could promote the World Health Organization's acceptance, which it has, of traditional Chinese medicine, so that it can be marketed across Africa, so that they can presumably eat the rhino horns themselves after they go poaching the last rhinoceros on Earth. Tedros Ghebreyesus expressed a reluctance to use the term until the COVID-19 disease spreads more widely and causes more harm, in order, it seems, to prevent fear or panic. So he didn't want to risk causing fear or panic by telling people this is going to turn into a pandemic, viral pneumonia. It's going to kill 7% of the world's population unless we lock down and stop it, because that might reflect badly on his Chinese paymasters. And he's a bureaucrat trying to keep the people at the top happy, just like the people on the Wuhan Health Committee who were trying to keep the people at the top happy. Paid bureaucrats can be a big problem in the system, you know, like they've got their own career priorities and they don't really care about the realities because they probably think that the world is bigger than their ability to influence. But anyway, yeah, Tedros Ghebreyesus, yes. He's led the World Health Organization into disrepute badly on the traditional Chinese medicines and on the response to coronavirus. And I think it was probably all the same corruption and bribes that set both situations up. But that's just a guess. Speaking as a hillbilly, we continue. In fact, it looks like the World Health Organization is no longer using any particular official criteria to trigger the use of the word pandemic, although it says it is still prepared to use the term when it sees fit. The decision seems like an odd one. To many infectious disease experts, the virus, which now has significant outbreaks in South Korea, Iran, and Italy, see page 7, has already reached pandemic levels. Regardless of what we call it, we appear to be entering a new phase of the global outbreak. Efforts to restrict the COVID-19 virus to China have failed, and in some countries the focus will have to turn towards mitigation rather than containment, as they try to slow the spread of the infection to stop hospitals all being overwhelmed at once. This means that the scenario in which the virus eventually spreads worldwide and most of us encounter it is looking more likely. If this happens, the virus will ultimately become like flu, a widely circulating infection that most of us will eventually acquire some immunity to, but before then the human cost will be high, especially among the over 60s and people with some pre-existing medical conditions. Flu can already be deadly for these groups, but at least we have some previous immunity to flu strains, and vaccines are available each flu season for the most vulnerable amongst us. Right now, almost none of us have immunity to this coronavirus, and it will be many months before the vaccines against it currently in development can be proven both safe and effective. The more we can do to slow the virus, the more time we buy ourselves to get prepared. As individuals, we should do everything we can to help authorities reduce the speed at which the infection spreads. This was about the time when Trumpy was boasting that you couldn't fly from China to America unless you were an American or a Chinese person flying to visit their family or for business, but you were quite happy to fly into America from Italy and the rest of Europe. And on the news, 29 February, COVID-19 goes global. Soldiers on the streets in Milan in Italy, well, yeah, they did a real good job keeping the virus at bay with their guns. Didn't that work well? We are failing to detect 2/3 of people travelling globally who are infected with coronavirus. We also don't know the source of many of the more than 250 cases in northern Italy, and there are a handful of similarly untraceable cases in 7 other countries. Until now, efforts to fight the virus have focused on containment, in which all detected cases and their contacts are quarantined, but when there is enough infection about, people catch it without it being obvious who they got it from. And by the end of February, the health coverage was on genetic influence on contracting HIV. 7th of March, Pandemic Special Report. Parallel problems. Our fight against climate change offers useful lessons for tackling the coronavirus. We are facing a global emergency, and politicians who appear to not believe in science are putting us all at risk. That this statement applies equally to coronavirus, see our special report starting overleaf, and climate change, says something about the era in which we live. Our response to the ever-widening outbreak has surprising parallels with our efforts to tackle global warming, although at accelerated speed. There are some transferable lessons. First, we must listen to scientists. There have been reports of public health officials in the US being told not to speak to the media without first clearing it with the White House. This is a mistake. As with climate change, open discussion of the risks and uncertainties is the only way forward. Likewise, science alone can't guide our response. In the coming weeks, politicians will face difficult decisions over whether to restrict people's movements, perhaps even locking down cities, as happened in Wuhan, China, where the COVID-19 outbreak began. They will need to weigh the social and financial fallout against the public health risk. Many people can't afford to self-isolate without pay for 2 weeks, so should governments pay them to stay at home? A virologist can't answer that. As climate change rises up the agenda, people increasingly look for advice on how they can help mitigate the crisis, whether it be flying less, recycling, or reducing meat intake. The role of individual action in this fight is still being debated. But with the coronavirus, it's clear that hand washing will help protect your own health and that of others. In fact, as the virus spreads, we may need to take more drastic action, such as preparing food supplies to allow us to self-isolate. Younger, healthier people in particular should see this as a civic duty. Although they may only develop mild symptoms if they become infected, they risk passing the virus to people who are much less likely to be so lucky. This isn't a call to panic buy or begin prepping a bunker. As with climate change, we must calibrate our caution, neither denying the issue nor giving up. nor giving up in despair. The virus can be beaten, but at what cost will depend on our response. Special report, COVID-19 spreads in US, with cases detected in more than 70 countries, and outbreaks not only in China but also in South Korea and Italy and Iran. The novel coronavirus first detected in Wuhan, China, has truly gone global. This week it emerged that COVID-19 virus could already be circulating in the US. Similar genetic sequences were detected in viruses from two people who contracted the disease weeks apart. One comes from a case in Snohomish County, Washington, in which the infected person had no contact with another known case or outbreak location. Despite this, the virus closely matches that in the first infection detected in the US on 21 January in a man in the same county who had visited Wuhan. Both sequences share a rare single mutation. This strongly suggests there has been cryptic transmission in Washington state for the past 6 weeks, tweeted Trevor Bedford at the Fred Hutchinson Cancer Research Center in Seattle. Testing in the US has been limited. China is doing 1.6 million tests a week. South Korea is testing upwards of 10,000 people a day, and the UK had tested about 13,000 suspected cases by 28 February. By then, the US had tested only about 2,500 people, partly because only those with links to China were being tested. On that day, however, the US Centers for Disease Control and Prevention issued new testing guidelines to permit the testing of potentially locally acquired cases. 3 were immediately reported in California, Oregon, and Washington, including the latest Snohomish case. Caitlin Rivers at Johns Hopkins University in Maryland says the US should now test hospitalized patients with severe respiratory disease of unknown cause to see if they have COVID-19. On 3 March, 105 US cases had been confirmed. On Tuesday, the UK government published a 27-page document setting out the UK's response to the virus. The report warned a coronavirus outbreak could lead to school closures, police dropping low-priority cases, and the National Health Service delaying non-urgent care. The document acknowledges the potential impact on businesses. Quote, in a stretching scenario, it's possible that up to 1/5 of employees may be absent from work during peak weeks, it says. UK government's response is focused on containment and planning for delaying and mitigating the outbreak. UK officials hope to delay the peak of the virus until the warmer spring and summer months when health services are less busy. If the disease becomes established, mitigation procedures will be introduced. These could include police concentrating only on serious crimes and maintaining public order if faced with significant loss of officers and staff, and the NHS calling retired staff back to duty. Local authorities may have to deal with, quote, an increase in deaths, unquote, particularly among vulnerable and older people, and the government is considering how to distribute the UK's stockpiles of key medicines and equipment such as protective clothing. In a sign that the military could be called in to help, the document says there are, quote, well-practiced arrangements for defence to provide support to civil authorities if requested. The number of people in the UK who've tested positive for the virus stood at 51 as New Scientist went to press. I think they've had over 25,000 deaths there now. Visual report. Largest outbreak was in China back in them days. And Trumpy's comments are making New Scientist magazine. Since the start of the outbreak, my administration has taken the most aggressive action in history to protect our citizens. US prissy dunce on the 2nd of March. Why the World Health Organization won't use the P word. There are no criteria for a pandemic, but COVID-19 looks like one. The answer may lie with what kicks into gear when we deploy the P word. Countries have pandemic plans that are launched when one is declared, but these plans may not be appropriate for COVID-19. There are no global criteria for a pandemic. There used to be for flu, but the World Health Organization abandoned them when it was criticised after declaring a flu pandemic in 2009 that triggered expensive countermeasures in some countries. The Chamber of Commerce doesn't want anybody to declare a pandemic. It's bad for busyness. The World Health Organization seems to have a third problem with the P word. Using the word pandemic now does not fit the facts, but it may certainly cause fear, said Tedros, the yes man. Asked about the World Health Organization's reluctance to declare a pandemic, a spokesman said, "It's important to focus on actions and not words." True, but words matter. Reluctance to tell the public the truth for fear of causing panic has plagued responses to other disease emergencies, notably bovine spongiform encephalopathy, or mad cow disease in the UK. Special report continues. Boris Johnson says his country remains extremely well prepared. And a special report on coronavirus has reached the finance pages. And in the views column, they're asserting that China has shut its wildlife markets for good. Yeah, well, that turned out to be a bit of a overstatement. What are we here? 14th of March. We have 6 stories on coronavirus listed in the table of contents. This is really nothing like flu. For weeks now, the news has been dominated by the coronavirus. This is hardly surprising. It is an unprecedented global story with an unknown ending, featuring a new virus we don't yet fully understand. The planet's most populous nation shut down an entire province to try to contain it, and now there is an exponential uptick in cases worldwide. It's no wonder everyone's talking about the virus, giving many people a worrying about the risks to themselves or their loved ones. No wonder, too, that inaccurate articles and even conspiracy theories are flourishing, and that warnings to be ready for self-isolation have led to panic buying. Inevitably, perhaps, with the numbers of diagnosed cases currently still low in many countries, a backlash is underway. There is a view that the fatality rate will turn out to be tiny, that the new virus is no more noteworthy than flu, and that the economic harm of containment measures doesn't justify the lives they could save. The media, meanwhile, is being accused of stoking panic in its reporting. But as Michael Leavitt, a former US Secretary of Health, put it last week, anything said in advance of a pandemic seems alarmist. After a pandemic begins, anything one has said or done is inadequate. The best information now available suggests a fatality rate of around 0.7%, see page 8, which means the COVID virus has the potential to kill a large number of people worldwide. The virus differs from flu in that there is no widespread immunity to it. The only people likely to have any are those who already have it. What's more, unlike flu, we have no vaccines to give to those who are most at risk. All this means that concern over the virus and considered action to delay its spread, such as meticulous hygiene and not taking your runny nose to work if you can avoid doing so, are fully justified. While much of China has seen a death rate of 0.7%, the fatality rate was far higher in Wuhan, the city with the first cases, where hospitals were hit with many cases at once. Far from constituting a panic, precautionary action to tackle the virus is only sensible. Also, this business of 0.7%, not only is it 700% higher than ordinary flu, it's also not correct, because you only get a fatality rate of 0.7% if you divide today's number of total deaths into today's number of total confirmed cases. But you don't die the day you get the case confirmed. It takes you 2 to 3 weeks to either recover or die after you get your severe case confirmed with a swab test. So take today's total number of deaths, divide that into 18 days ago's total number of confirmed cases, and you don't get 0.7%, you get 7.5%. How the editor of New Scientist magazine could have accidentally missed that is beyond me. My personal hypothesis to explain it is that the gentlemen of the press did not want to panic the horses. They have minimised the apparent potential impact of coronavirus by coming up with doctored figures, massaging the data to try and make it look less scary because they really didn't want to panic. Pretty much exactly the same as what they were accusing the World Health Organization of having done. So the news page has more gun-toting soul die errors running around in Italy trying to shoot the virus. Italy's put the country's 60 million people on lockdown in the most drastic action taken outside China to tackle the spread of coronavirus. As of 10th of March, the country had diagnosed more than 10,000 cases, second only to China. Yeah, well, that went well, didn't it? And by the 14th of March, a whole bunch of Europeans and Americans had been to northern Italy for skiing holidays. Major testing issues in the US. More than 7 weeks since the first case of corona in the US, but according to one estimate, fewer than 2,000 people across the country had been tested for infection by the 7th of March. In contrast, reports suggested more than 190,000 people had been checked in South Korea. One reason for the low figure in the US lies in problems with the tests developed by the Centers for Disease Control and Prevention. Although it sent test kits out to state laboratories on the 5th of February, by 12th of February it was clear there was a hitch with one reagent used in the test, and many state labs couldn't use the tests. Why corona death rate is so hard to pin down. Age, diabetes linked to risk of death. Number of cases so low in Africa because they weren't testing. Oh, and the mad, crazy hunt for corona-19 drugs. One of the 2 hospitals the Chinaman built was run by robots. There are 2 types of new corona. What does that mean? 2 strains of the new corona are spreading around the world according to an analysis of about 100 cases, but the World Health Organization insists, quote, there is no evidence that the virus has been changing. So how many strains are there and does it matter? Viruses are always mutating, especially RNA viruses like this one, the COVID-19 virus. When a person is infected with the coronavirus, it replicates in their respiratory tract. Every time it does so, about half a dozen genetic mutations occur, says Ian Jones of the University of Reading, UK. When Xiaolu Teng at Peking University in Beijing and his colleagues studied the viral genome taken from about 100 cases, they identified 2 types of this virus. 72 were considered to be the L type and 29 were considered as the S type. The work suggests that the L type was derived from the older S type. The first strain is likely to have emerged when the virus jumped from animals to humans. The second strain emerged soon after that, says the team. Both are involved in the current global outbreak. The L type being more prevalent suggests it's more aggressive than the S type, the team says. There do appear to be 2 different strains, says Ravinder Kanda at Oxford Brookes University in UK. The L type might be more aggressive in transmitting itself, but we have no idea yet how these underlying genetic changes will relate to disease severity. The difference between the 2 identified strains are tiny. In fact, they can't really be considered to be separate strains, says Jones, and many of the differences won't affect the production of proteins, so won't change the way the virus works or the symptoms it causes. One is not more deadly than the other. In practical terms, the virus is as it was when it originally emerged. There's no evidence it is getting any worse. This sentiment is echoed by the World Health Organization. The study by Tang and colleagues only suggests there is some genetic diversity of the virus. It doesn't mean it is changing, a representative told New Scientist. Well, that's kind of confusing. And the Views column talks about how to worry better with an article on stockpiling toilet paper. 21st of March. 4 coronavirus stories in the table of contents. Off with the editorial testing times. Abruptly, the world is in lockdown. Many of the countries that aren't there will be there shortly. In the UK, advice to stay at home and government restrictions have arrived more slowly than in neighbouring nations. That has sparked criticism from a number of scientists outside the government science advisory team. Such disagreement has been confusing for a public so often encouraged to trust the experts, especially in the middle of this pandemic. Who do they trust when the experts disagree? The fact is, no one knows what the correct course of action is. Epidemiologists have a saying, if you've seen one pandemic, you've seen one pandemic. We're in an entirely novel situation, not least because coronavirus is so notably different from flu. We will understand this pandemic only when we have more data. That is why, as countries scramble to boost their intensive care capacity, they should also listen to the advice coming from the World Health Organization to test, test, test. As a World Health Organization Assistant Director General Bruce Alward tells us in this issue, to actually stop the virus, China had to do rapid testing of any suspect case, immediate isolation of anyone who was a confirmed or suspect case, and then quarantine the close contacts for 14 days so they could figure out if any were infected. Those were the measures that stopped transmission in China, not the big travel restrictions and lockdowns. Yeah, I think that might have been a message from the Chamber of Commerce too. There are hard days ahead. Alward explains that the lockdown is the hard part, and effectively isolating all COVID-19 cases is the really hard part. Our feature on the race for a vaccine reinforces the fact that there will be no quick or neat solutions to this crisis. We are all adjusting our new lives in the time of the coronavirus, but signs of strong community spirit are already emerging. Many people are doing everything they can to not only limit the spread of this virus, but also to support the most vulnerable people in their communities. This is a war in which we can all really do our bit. World Health Organization calls for more testing. The country's getting it right. South Korea and China get a Guernsey early on. Public enemy number one. No, this virus isn't a bioweapon. New diseases have emerged throughout human history, and we have seen two major coronavirus outbreaks in the last 2 decades, SARS and MERS, so we shouldn't be surprised by the arrival of the COVID-19 virus. However, rumours on social media suggest the outbreak was human-made. Some say the virus leaked from a Chinese lab studying coronaviruses. Others suggest the virus was engineered to spread among humans. Even the most secure laboratories do sometimes have accidents, and a human-engineered pandemic has been identified as a possible risk to our civilization. But there is no good evidence that either has happened. Many similar viruses are found in wild bats, and it seems likely that is the origin of this one, probably via an intermediate host. Similarly, we know that both SARS and MERS came from bats, so there is no reason to invoke a laboratory accident. Researchers led by Shan Liu at Ohio State University say there is, quote, no credible evidence of genetic engineering. The virus's genome has been sequenced, and if it had been altered, we would expect to see signs of inserted gene sequences, but we now know the points that differ from bat viruses are scattered in a fairly random way, just as they would be if the new virus had evolved naturally. Not made in China, evolved in China. A bunch of the people who support Trumpy don't believe in evolution either, do they? Okay, to the most recent one that I read all of, 28 March. 5 cases on corona in the table of contents. Strange new world. Exercise is just one part of what we can do to strengthen our body's defences against disease. World in lockdown. Around a fifth of the global population is in lockdown. Drug search continues. There's been much enthusiasm for promising medicines, but it's unclear if any will help those who really need them. US President Donald Trump was wrong about the drug chloroquine. A bunch of scientists are unimpressed by the scientific advice accepted by the British government. Results are in that it's pretty easy to be infectious without having any symptoms. 86% proportion of cases in China which had no symptoms or very mild symptoms. 14 days an infected person may take this long to develop any symptoms. 15 hours. People who have symptoms are most contagious 15 hours before the symptoms begin. And there's apparently no evidence that recovering from the virus gives you any more than 3 months worth of immunity from the virus. Which, if true, may mean that there is not going to be an effective vaccine for it any more than there is an effective vaccine for the common cold. In the Insight column, the way society functions in the US has made it more vulnerable to pandemics. Could things be different? The US is probably the developed economy with the worst type of healthcare system to tackle COVID-19. Many economic and healthcare policies it has enacted don't prioritise public health, and it's finding out firsthand how dangerous that can be. The impact of this has been seen in the past month or so in the lack of testing. We don't have enough resources to do the testing quickly enough and have been slow to measure the epidemic and reduce its spread. But the long-term issue is that many people in the US simply don't have adequate health care, he says. The biggest holes in our system are the issues of affordability and financing. About 8% of people in the country don't have health insurance, and many more have plans that don't cover the full cost of health care. In early March, a man in Florida said that even though he had health insurance, he was expected to pay about $1,400 to get a test for COVID-19. As businesses close to enable social distancing, some people will lose their jobs and with it their employer provided health insurance. Australia has universal free public health care. Called Medicare. It used to be called Medibank. It was brought in 1972 by Labor Prime Minister Gough Whitlam. I vaguely remember back in the days when there was no free public health care. I spent my whole career as a nurse working in public free health system. I can't imagine why the Americans continue to vote to have a ridiculous system in which most of the money that gets funneled into their health system goes to shareholders in the insurance industry. But they seem to like it that way. On the other hand, most of the shareholders in the insurance industry in the excited states are old and they're unwell. And most of them can afford to have servants. And the servants are poor and overcrowded and stressed out. So I'd say the poor, stressed, overcrowded servants are going to infect the old, unwell, rich shareholders. And one way or another, coronavirus is going to change the shape of the commercial world. And in the views column, beyond the science of COVID-19. Right, that's the pile of stuff that I have read. Here we have current New Scientist, 4th of April, coronavirus, still on the top of the front cover. 6 stories on coronavirus. Estimates of COVID-19's predicted death toll are bound but are of little use. We can't know yet whether we can slow the pandemic long enough to even develop drugs and vaccines for it. Crisis in New York City. As of 30 March, a city of 8.6 million people had 38,087 confirmed cases. 914 people had died of COVID-19. In one 20-hour period last week, 2,000 people were hospitalised. New York City is experiencing shortages of ventilators to help the most seriously ill breathe when infection overwhelms their lungs. Protective gear is also in short supply. Epstein has to reuse her N95 mask day after day and is only issued 1 gown per day. Cuomo said the city will need 30,000 ventilators at the peak of the outbreak. De Blasio has asked President Trump to divert medical equipment to the city. In a Fox News interview on 26 March, Trump responded, "I don't believe you need 40,000 or 30,000 ventilators. You go into major hospitals sometimes and they'll have 2 ventilators. And now all of a sudden they're saying, can we order 30,000 ventilators?" Epstein calls this a disregard for human life in the city, adding, "I very much think things are just going to get worse." And yeah, coronavirus is still the big one. Hunt to find the coronavirus's patient 0. According to a study of the first 41 people hospitalised with COVID-19 published in January, The Lancet, the case of COVID-19 was a man who showed symptoms on 1 December 2019. Unlike the majority of early cases, he had no links to the Hunan seafood market. Since then, no one has been able to confirm where he caught the virus or if he was even the first person to contract it. Another January analysis of the first 425 COVID-19 cases conducted by the Chinese Centre for Disease Control and Prevention and Chinese National Health Commission placed the first confirmed case a week later on the 8th of December. But subsequent evidence hints that the outbreak probably began before December. Viral genome analyses suggest the virus jumped from animals to humans in November, but it could have happened as early as late September. This is consistent with South China Morning Post report on Chinese government documents that suggest the earliest case of COVID-19 may have been a 55-year-old person from Hubei province who seems to have contracted the virus on 17 November. The first cases to be flagged in December were reported by Wuhan doctors using a surveillance protocol designed to pick up the pneumonias with unknown causes. The system was set up after the 2002-2003 SARS outbreak to detect new viruses. Following this, new scientist understands that early efforts by Chinese authorities to identify COVID-19 cases focused only on people with viral pneumonia who had traceable links or contact with the Hunan market. This focus on pneumonia may mean that many milder cases were missed. By December, infections had probably already spread outside Wuhan. A study of 6 children who contracted the COVID-19 virus identified a girl who had developed symptoms on the 2nd of January. She and her family live in Yangzin, more than 150 kilometres from Wuhan. None of them had travelled outside the county for a month before she became ill, and researchers weren't able to identify how she became infected. One explanation for this could be that the virus has jumped into humans from animals several times. Bats are thought to be the reservoir of COVID-19 virus, but Richard Koch at the Royal Veterinary College in London says catching it from a chance encounter with a bat is unlikely. A more probable scenario is that other animals may have acted as intermediaries, amplifying the virus and enabling it to infect multiple humans in a method of trial and error. The COVID-19 virus appears to be able to infect a range of hosts. Lab studies have found that it readily infects rhesus macaques and ferrets. Sunder pangolins have been suggested as an intermediate host because they harbour coronaviruses similar to COVID-19 virus. So far, genetic analysis has found viruses in pangolins that are more than 90% match for the COVID-19 virus, but none similar enough to be the direct precursor. The role of the Hunan market may have played in enabling the virus to cross over people is now uncertain. The problem is that most samples in the Hunan seafood market have been destroyed. It's still a possibility that the environmental contamination in the seafood market was from infected humans who were working there rather than from an animal source. The market's also one of 400 in Wuhan. If there was an amplifying population of animals that were then supplying 400 markets, plus directly to restaurants, there's a huge capacity for crossover events to take place. Now that human-to-human transmission has spread the virus worldwide, some believe the hunt for patient zero, the first person infected in the outbreak, is of relatively little importance. At our stage of the epidemic, it's not really the prime focus to know where it comes from, says Julian Rieu at the University of Bern in Switzerland, but Koch says identifying the source of the outbreak is crucial, given that 3 coronaviruses, the SARS, MERS and COVID-19 viruses, have all emerged since 2002. In evolutionary terms, that's in microseconds, he says. The risk of these things happening has enormously accelerated. We have to get a grip on that. Knowing more about the event that led to the COVID-19 virus spreading to humans could help us how to figure out how to stop it from happening again, says Cowling. Coronavirus environmental effects. Venice's canals are benefiting from the absence of boats. The pandemic will certainly have consequences for climate change. See page 23. Planes grounded across the globe are no longer contributing to global warming, but record atmospheric concentrations of CO2, which climbed to a new high in February, are unlikely to reverse. Experts say it's too early to detect any short-term impact in March from coronavirus responses. However, observers think that global CO2 emissions are likely to drop in 2020, ending several years of slow growth. This year I expect the emissions to decline significantly, but in my view this is not a reason to be happy. Emissions are going down for the wrong reasons, he says. Fatih Birol at the International Energy Agency. Based on existing economic forecasts, they will fall at least 0.3%, but probably much more, according to Glenn Peters at the Centre for International Climate Research in Norway. A separate estimate by the Breakthrough Institute is for a fall of 0.5% to 2.2%, but annual drops of 7.6% are needed to keep global warming below 1.5%. So we need a 7.6% drop in CO2 emissions, and coronavirus kills 7.5% of the people who are confirmed to have the virus. That's an interesting equation, is it not? In Venice, the canals may simply be clearer because boats aren't stirring up sediment from the city's lagoons and canals. Without measurement, it's impossible to say if water quality is better, says David Tagliapietra at the Institute of Marine Sciences. And then they're back to testing for coronaviruses. Who will get the ventilators? Well, guess what? 90% of the people who get put on the ventilators are dead. It just takes them 3 weeks to die. Should you disinfect your online shopping? In the views column, they have a look at tackling 2 crises at once. Talk about the benefits of going out into the outside world despite being in lockdown. Interesting piece featuring David Attenborough. We've not just ruined the planet, we've destroyed it, says David Attenborough. The broadcaster has spent his days recording the wonder of the natural world, only to realise that his life's work has in fact been to document its demise. Growing up in the 1930s, 66% of the world was wilderness, and carbon dioxide levels in the atmosphere were some 310 parts per million. By the time Blue Planet started shooting in 1997, says the film, wilderness was down to 47% and CO2 was 363 parts per million. The numbers are much worse now. Wilderness covers just 23% of the world, and atmospheric CO2 stands at more than 410 parts per million. You see why this bat-eater's lament virus coming out of Wuhan in China seems to fixate on killing old men? Because we've been in positions to make decisions. In my case, been voting for 40 years. My parents' generation been voting for 60 years. Okay, 11th of April. How do we get out of lockdown? Things are hard. Coming out of lockdown will require difficult decisions. The execution of a strategy to end lockdown is weeks away, but the decision on how to do it needs to be made now. Meanwhile, the global situation is about to change in ways we can't predict as the virus takes hold in poorer countries. Low-income economy countries will face different challenges from those seen in the relatively rich countries hit worst so far. To take one example, Uganda has 0.1 intensive care unit beds per 100,000 people, compared to 34.7 in the US. In other nations, slums and refugee camps where isolation is well nigh impossible are a big concern. The full impact of this pandemic has yet to emerge. Need to cut global emissions by 7% per year. Coronavirus kills 7% of the people who are confirmed to have it. There may be no immunity from the coronavirus, so it may come around every year. That'll work. It will work. 7.5% is 7.5%. If we do that every year, I can see emissions coming down. Death rate mystery. As figures pour in, the estimates of COVID-19's death rate still vary wildly, from as low as 1 in 1,000 to as high as 1 in 30. That is because the risk depends on your age, sex, health, and the care you receive. In other words, death rates will vary from place to place and over time. In the UK, as of 5 April, 4,934 people had died out of 47,806 confirmed cases, a crude case fatality rate of around 10%. For Italy, the figure is 12%, for Germany, just 1%. These figures don't tell us how many of those who are infected will die, known as the infection fatality rate. That's because crude case fatality rates don't take into account the fact that some of those counted in the confirmed case numbers haven't recovered yet and may still die. Early in March, for instance, South Korea had a crude case fatality rate of just 0.6%. That has risen to 1.7%. Among resolved cases, those who have died or recovered, the case fatality rate in South Korea is 2.9%. Age is a factor. In South Korea and Germany, the first people to be infected were mostly younger. Based on what is happening in Italy, Mills and her colleagues calculate that if 10% of people had become infected, there would be 302,530 deaths in Italy, with its ageing population of 61 million. But 142,058 deaths in Nigeria, with its much younger population of 191 million. If lots of infected people with mild or no symptoms are being missed, the infection fatality rate will be much lower than the case fatality rate. For example, the UK is testing only severely ill people and missing mild cases, but South Korea and Germany are testing more widely. Now, we still can't say for sure what the infection fatality rates are. This will start to become clearer if antibody testing can reveal who has been infected in the past, thus the number of missed cases. An uneven pandemic. I just pretty much covered that. Studies of confirmed cases so far show that people with coronary heart disease or diabetes are more likely to die than other people if they catch the coronavirus. Individuals with lung disorders such as chronic obstructive pulmonary disease and smokers are also at greater risk. As we begin to understand the virus better, focus is turning to a protein called ACE2. The coronavirus attaches to this receptor protein on the surface of our cells to gain entry to them. The protein is carried by cells in the nose, lungs and gut. It's possible that a variation in how much of this protein people have may explain why some are more likely to die from COVID-19. The link between COVID-19 deaths and diabetes and cardiovascular and heart conditions has led some concern over ACE inhibitor drugs. These drugs, which are used to treat high blood pressure, coronary artery disease, heart failure and diabetes, work by targeting the ACE enzyme, a different protein, but one that works alongside ACE2 to regulate blood pressure. Study of 106 people with COVID-19 by Yong Xiong at the Yongnan Hospital of Wuhan University, China, and his colleagues found that having hypertension, diabetes or cardiovascular disease was linked to patients clearing the virus from their bodies more slowly. Teams suggest the ACE inhibitor drugs taken by some of these people may have increased their levels of ACE2, providing the virus with more opportunities to dock onto their cells, although the study didn't show whether this was the case. So they don't know the why-fors of it, but the raw statistics mean that if you're 60 or 70 years old and you're overweight and you're unwell and you've got a couple of health issues, it's a good idea for you not to catch coronavirus unless you plan on taking up a career in pushing up daisies, really. It's specialised in hitting old, unwell humans who've been around for a while, particularly the ones who haven't been really careful with their health. We have a feature on how to get out of lockdown running to 3 pages. In the views column, we discuss the fact that children seem not to be infected, not to be affected if they are infected at anything like the rate that adults or old people are. And we start to get into the debate on tracking apps so that everybody's mobile phone can use Bluetooth to tell somebody at some point who they've been close to. So that if somebody they've been close to comes down with the virus, then the phone can tell the authorities who to go and test next. 18th of April, 5 stories on corona. Oh, what fun. In the Congo, they've got Ebola as well as corona. We have a 2-page feature on how Hubei fought the virus. That's Hubei in the orange. Australia gets a Guernsey. Early signs suggest that Australia is beating the coronavirus with the rate of new infections slowing for more than 2 weeks. But will the trend continue? Well, so far, it pretty much is. Despite the successes, Australia has also committed some major blunders. For example, 2,700 passengers were allowed to disembark from the Ruby Princess cruise ship on the 19th of March, even though many were showing COVID-like symptoms. More than 600 cases have now been linked back to the ship. Some Australians have also ignored social distancing recommendations and crammed onto beaches near to parks. Government says it's looking at ways to ease restrictions but won't make any decisions until it sees how the coming weeks pan out. At the moment, about 10% of Australians who have caught the virus don't know how they got it, which is a sign of community spread. Although this is a small proportion, it could easily spiral out of control if restrictions are lifted too early and people are allowed to mix too freely. Coronavirus may trigger post-viral fatigue symptoms. Is wearing a face mask a good idea? Look, they're surgical masks. Surgical masks are designed to catch your exhaled breath and stop you from dribbling droplets into the wound of the person you're operating on. Surgical masks are only functional if they are water resistant, because if they're not water resistant, they become saturated with your exhaled breath. If you're wearing a cloth mask, which is not water resistant, it will rapidly become saturated with your exhaled breath. And then when you breathe in, snot drops of somebody else will sit on the outside and the coronavirus can make its way through the wet surgical mask every time you breathe in. If you're going to wear a mask to keep you safe, you need a P2 mask or an N95 mask. That's a mask that's made out of water-resistant material, which fits, which filters material down to 2 microns going through the synthetic felt of the mask material itself. And then when you go to breathe out, it's got a little rubber spring flap valve, an exhaust valve. So whatever you're breathing out goes straight out through the mask. It doesn't wet the material of the mask. I've got one of those. I've had it since 2002 when I was issued it to go and fight a bushfire with, big firestorm. I kept it in the upper compartment above the netting cradle of my firefighting helmet. When I was really worried about going into the supermarket, I'd put on my P2 mask and gloves, and I'd go and do my shopping, and then I'd discard the gloves into a plastic bag and put the mask aside and then stick it in the ultraviolet on the dashboard under the windscreen of my car, and let the ultraviolet get to both sides of it. And then I would give it a squirt with Glen 20, which is over 60% alcohol. And then I would reuse that same mask. If I was visiting my mother, who has an impaired immune system, I would wear a surgical mask to stop me from spreading any droplets into her, because that's what the surgical mask is for. It's to catch your exhaled breath. Is it a good idea to tell people to run around wearing cut-down T-shirts? Probably not medically, but from a community involvement point of view, getting people thinking about it, it might have overall benefits. I don't know. It's a really line ball call and nobody knows the answer to it. If you want to make your own mask, make it out of vacuum cleaner bag material. According to a 2013 study that compared various household materials based on their ability to filter bacterial and viral aerosols, tea towels were reasonably effective, but linen and silk performed poorly. If you do wear a mask, it's important to use it properly. It's easy to contaminate your own mask by touching or reusing it, for example, and don't let wearing a face mask give you a false sense of security. You can still become infected while wearing one, and washing your hands frequently is vital whether you wear a mask or not. Even if everyone followed this advice, it isn't clear whether widespread use of face masks would have a significant impact on the spread of the virus. The World Health Organization says it is still trying to understand whether they work. There's just not a lot of evidence for cloth masks in the community. And apparently a lot of people whose relationship was a bit spotty are finding that it's absolutely untenable in the lockdown. Finally, my most recent New Scientist, which has 4 coronavirus stories. Lessons from the past can help us deal with the pandemic's mental health fallout. Concerns over UK advice. Key scientific data and advice to the UK government won't be published until the coronavirus pandemic ends. Okay, so they're playing politics. Men hit harder by COVID-19. From lifestyle to immune system differences, there are a number of reasons why men may be more affected by COVID-19. We know that older people are more vulnerable to COVID-19, but another major risk factor has emerged, being male. The first signs of a sex difference in COVID-19 severity emerged from hospital records in Wuhan, China, shortly after the city locked down. 30 January, a team at Shanghai Jiaotong University at the School of Medicine published a report on 99 COVID-19 patients who were admitted to the Jinyi Tan Wuhan Hospital between 1 and 20 January. Researchers found that among those admitted, men outnumbered women by more than 2 to 1. There's also been a sex difference among deaths. Mortality data from 21 hospitals in Wuhan between 21 and 30 January, for example, revealed that 75% of those who died were men. Since then, larger studies from other countries have backed up these earlier findings. In England, Wales and North Ireland, for example, around 70% of critically ill patients admitted to intensive care have been male, and a higher proportion of men than women have died. A study of more than 4,000 COVID-19 patients in New York City hospitals found that 62% were male. The difference doesn't appear to be caused by differential rates of infection. The New York study, for example, found that equal numbers of men and women catch the virus, but men are more likely to progress to severe illness and death. Two previous emerging coronavirus diseases, SARS and MERS, have also been found to disproportionately affect men, but this isn't the case with respiratory infections generally. The report on England, Wales and North Ireland also looked at sex data on patients critically ill with viral pneumonia between 2017 and 2019, mostly due to influenza. There was an excess of men in this cohort too, but the ratio was less stark, 54 male deaths for every 56 female deaths. One possible reason for the sex difference is smoking. In China, over half of men smoke, but only 5% of women do. Tobacco smoke appears to cause lung cells to produce more of a surface protein called ACE2, which the virus exploits to infect cells. This may mean that smoking makes cells more susceptible to the virus. However, according to an analysis by Linda Kay at the University of California, Los Angeles, this hypothesis isn't supported by the data. Current smokers only make up about 12.5% of people severely ill with COVID-19 in China, she says, which is much lower than the proportion of smokers in the general population. Another possibility is that men, older men in particular, are in generally worse health than women. They tend to have higher rates of obesity, high blood pressure, diabetes, cancer, and lung and cardiovascular diseases, all of which have been linked to COVID-19 severity. When the authors of a New York study factored in these conditions into their analysis, they found that sex was no longer one of the main risk factors for severe COVID-19. Another, not necessarily unrelated idea is that women may naturally have a stronger immune defences. Quote, there are substantial more differences in the immune system between males and females, and these have a significant impact on outcome from a wide range of infectious diseases, says immunologist Philip Gilder at the University of Oxford. One key difference is that women have 2 X chromosomes per cell, whereas men have 1. A number of critical immune genes are located on the X chromosome, says Gilder, in particular a gene for a protein called TLR7, which detects single-stranded RNA viruses like coronavirus. As a result, this protein is expressed at twice the dose on many immune cells in females compared with males, and the immune response to coronavirus is therefore amplified in females, he says. While one X chromosome is usually inactivated in each female cell, the TLR7 gene somehow escapes this in some immune cells, meaning women produce more of the protein. There's also some evidence that female sex hormones such as estrogen and progesterone boost the immune system, but this hasn't been specifically investigated in COVID-19 yet. Another possibility is that men are simply less hygienic. They are less likely to comply with basic sanitation measures such as hand washing, says Kuniaro Matsushita of Johns Hopkins University in Maryland. A study of sex differences in China found that men with COVID-19 in hospital were more likely than women to be carrying other viruses, including flu and bacteria. It is possible that carrying more microbial pathogens may contribute to the severity of COVID-19 symptoms. Page on the problems of tracing apps. Crisis hits end of care and people are making living wills. Can breathing exercises help protect you? Deep breaths and forced coughs could help clear mucus, but are unlikely to help people with a dry cough and mild cases of COVID-19, despite what advice on social media would have you believe. Breathing exercises help manage some respiratory conditions like chronic obstructive pulmonary disease. The aims of the exercises are to clear the lungs of sticky mucus, coordinate your breathing with medication to deliver optimal dose, and to keep the airways open. But that's not going to help with coronavirus. Sorry. Why are ethnic minorities worse affected? Inequalities mean a disproportionate number of COVID-19 patients are from minority ethnic backgrounds. During the coronavirus pandemic, people from Black, Asian and minority ethnic (BAME, B-A-M-E) backgrounds are being hit particularly hard according to emerging data. The most recent figures compiled by UK's Intensive Care National Audit and Research Centre suggest that of nearly 5,000 people critically ill with COVID-19 in England, Wales and Northern Ireland, those whose ethnicity was known, 34% were from BAME backgrounds, but people from such groups make up only 14% of the population of England and Wales, for instance. In the US, figures released by the Centers for Disease Control and Prevention on April 18 showed that of about 120,000 confirmed COVID-19 cases where race has been specified, 36% were among non-white people, who account for 23% of the US population. Most were in black or African American people, who comprise 13% of the population, but 30% of all cases. The UK government has launched an inquiry into this overrepresentation, and Public Health England is the first UK health body to say it will begin recording COVID-19 cases and deaths by ethnicity. The differences are due to, quote, widespread health inequities, says Linda Sprague Martinez at Boston University School of Social Work in Massachusetts. Communities of colour are disproportionately impacted because of racism, unquote, she says. Quote, it's not about people's biological makeup, it's about the conditions that are created due to racialised policies and how that's impacted communities over time, unquote. For example, poorer, more disadvantaged people who are disproportionately from ethnic minorities are more likely to have underlying health problems such as heart disease, diabetes and obesity that puts them at increased risk of COVID-19, says Sprague Martinez. When we have environmental conditions that leave communities vulnerable, that's when we see an increase in chronic disease, she says. That's the result of policies that have left those communities marginalised, unquote. In the US, where healthcare isn't universally accessible, studies have found that black people miss out on treatment because of racially biased algorithms. They are also less likely to have health insurance and more likely to live in areas with fewer primary care doctors than their white counterparts. BAME individuals may also be less able to do social distancing at home. Quote, it's proportionately certain groups that still have to go to work, unquote, says Latifah Jackson at Howard University's College of Medicine in Washington, D.C. In the UK, 18% of black people work in caring, leisure and other services that are either essential or jobs that can't easily be done from home. In the US, less than 20% of black or African American people can work from home. These factors may be compounded by racial bias and discrimination in healthcare. Studies have found that people from BAME groups may be treated differently because of healthcare professionals' unconscious bias, says Jackson. This creates a system of advantage based on race, says Sprague Martinez. We have to take that into account when thinking about why we're seeing differential impacts of COVID-19. Yeah. Interesting, Leah Liverpool. Volcanic eruption caused by torrential rain. Now, that's an interesting theory. Okay, so that's the results, including 3.5 copies, which I have yet to fully read. In my opinion, whatever it's worth, I don't think the Chinese tried to cover it up as an official policy from Beijing. I think their culture in and among the bureaucrats attempted to cover up the fact that there was a problem from their central government in Beijing. And once Beijing got onto the fact that it was happening, they got right onto it. Different government departments did different things. I understand the Chinese Navy locked down all their bases. So whereas America has an aircraft carrier out of action because the crews had to be pulled away because a segment of the crew are all sick with coronavirus, China's Navy is in pretty good condition. None of their servicemen have had contact with people off base. Does that mean that China planned all this as a feat of germ warfare? No, I don't think so. I think different bureaucrats are more switched on than other bureaucrats. And it seems that the Chinese military woke up to the idea that if they want to maintain an operational posture, they have to do something about the virus, even though the Chamber of Commerce was trying to pretend there was nothing to worry about with the virus. In America, the business community has pretty much disgraced itself. I mean, Trumpy was trying to get Americans to go back to church by Easter Sunday. Why was that so? It was because the futures price for West Texas crude was about to go into negative territory, because with nobody flying or driving, nobody's buying oil, and the people who had bought responsibility to receive oil had no oil tank to put it in. They were paying other people to take the oil away. Trumpy represents the wishful thinking community. There was a bit of a hiatus in the reportage of deaths in America. From 46,000 to 58,000, they didn't report how many total deaths in America. Why was that so? Because 56,000 Americans died in Vietnam, and nobody wanted to be paying attention, or nobody wanted the population to be reminded to pay attention to the fact that in 3 months, Donald Trump's negligence, maladministration, malfeasance, ignorance, and ego have killed more American citizens than it took Johnson and Nixon 10 years to engrave on the Vietnam Memorial Wall in Washington. 3 months. Bad policy from Washington killed more people than 10 years worth of bad policy from Washington killed their own citizens in Vietnam. Right now, Trump and Pompeo and the entire Republican talking machine are attempting to very carefully mince their words to suggest that because it's not impossible that the virus came out of a germ warfare lab, the mere fact that it's inconvenienced America and it's killed American citizens means that it must have come out of a germ warfare lab. There's no evidence for that. All the evidence is that the governments who mismanage the disease suffer a higher toll. Italy wanted to keep its ski fields open. America wanted to have people flying in and out from Europe. Most of the cases in America came from Europe. Most of the cases in Australia came from America via the American cruise ships operating in the Pacific. But yeah, we need to reduce greenhouse gas emissions by 7.6% every year in the future. If there's no vaccine, and if there's no immunity, and if this thing's going to run around every bloody year, and if it's got an ultimate death rate of 7%, yeah, humanity's numbers are going to be trimmed to the point where we aren't capable of emitting sufficient greenhouse gases to further antagonise the global warming situation. It doesn't matter for the Kyoto Protocols and the Paris Accords and all the rest of it, because the Wuhan horseshoe bat has decided to cull humans. And the bat eater's Lament virus is doing an amazingly efficient job. And if it takes me out, well, okay, I'm in the age cohort. I am the particular sex that it's having a field day with. And obviously, I failed to convince my age cohort to behave any better than we did. We've trashed the planet. Now the planet is trashing our numbers. Such is life. All I can say is that anybody who reckons it's not fair hasn't been paying attention. This is all perfectly fair. We've had plenty of warning. We've known what we've been doing for over 150 years. Ever since carbon dioxide was discovered to be a greenhouse gas. This is the ecology's pushback. The biosphere is protecting itself from humanity. Such is life. Ned Kelly, such is life. Warbles on a lot to YouTube. Ciao.